Hi, my name is Samantha Swardell, and I will be going over my electronic binder that my chosen topic of edema management. So at the beginning of my binder, it starts off with the table of contents, which include a brief description of the selected topic, the 3 OT research articles, 3 interprofessional research articles, 3 documents of internet resources that are evidence-based research documents, 3 internet resources of organizations, 3 brochures that are patient education, assessments, chapters from the MSOT program textbook, questions from NEBCOT exam preparation resources, and finally, the references. So the brief description of the selected topic, I specifically selected the topic of edema management because of my passion of being a certified lymphatic therapist for the past 4 years. The gratification of helping others that suffer from edema is by far the greatest feeling I have ever received from assisting someone. Edema can occur in all parts of the body and is the accumulation of fluid in the soft tissue. Depending on where the edema is located, it can severely affect an individual's quality of life and performance of activities and instrumental activities of daily living. Edema in the hands can affect an individual's grip and dexterity by not allowing them to grasp or manipulate objects appropriately. Edema in the head and neck can hinder an individual's social interaction by production of speech and speaking fluently without pausing. Edema in the lower extremities can hamper an individual's motor skills of stabilization and alignment when completing occupational tasks. It can also affect their ability to sustain performance by evidence of physical fatigue when completing tasks requiring rest breaks. Physical agent modalities such as ice packs are commonly used by methods of occupational therapists in preparation for treatment sessions to treat edema to enhance occupational performance. So the first research article is the effect of relaxation techniques on edema, anxiety, and depression in post-mastectomy lymphedema patients undergoing comprehensive decongestant therapy. Uh, this this article described just how working with anxiety and edema correlate and benefit the patient by addressing not just one subject, but both of the subjects. Article 2 was a single case design evaluation of compression therapy for edema of stroke affected hands. The next one was occupational therapy management for work related upper limb disorders in computer users. So this one just focused on the effects of 19 individuals who received conservation techniques for edema, joint stiffness, sensation, pain intensity, typing speed, grip strength, and overuse syndrome due to using a computer for more than 20 hours a week. And then we had our 3 interprofessional research articles. The first one was edema assessment and management practice patterns among hand therapists. And then the second article was the acute care management of scrotal edema, status post external hemopivectomy. And this went over different techniques of how to decrease edema in the scrotum through complete decongestive therapy, which was through manual lymph drainage, exercise, compression, and skincare. Article 3, endometriosis, a clinical presentation first suggesting dermatomyositis diagnosis. So this was with lymphedema that could symptom of IM and edematosis myositosis. And then we had our 3 documents. The first document was on edema, a silent but important factor. It explains in great detail what edema is, the causes, and the different stages. So this one here, and attached to all of these is all the articles, which are all here, every single article and every single document. So it all has live links for what you need. And then document 2 is arm edema in breast cancer patients. Working with, as a lymphatic therapist, I primarily see breast cancer patients. Document 3 is the diagnostic approach to lower limb edema. The internet resources and organizations. The first one is Lymphology Association of North America, which is the LANA. And this is a nonprofit corporation founded in 1988, and it consists of healthcare professionals such as physicians, nurses, and therapists, both occupational and physical therapists that specialize in the management of lymphedema. Their sponsors include companies that promote lymphedema management through compression garments such as Juzo and LNR, and medical equipment from LymphoPress and Tactile, which are actual vasopneumatic pumps that can be used from the lower extremities, upper extremities, head and neck to torso as well. And their mission is to create awareness of lymphedema and promote national certification for healthcare professionals. The second organization was National Lymphedema Network. This is also a non-profit organization that started in 1988 and is internationally known, and its mission is empower the community and healthcare professionals through education, networking, and interventional resources. Organization 3 is the Norton School of Lymphatic Therapy. This is actually the school that I went through to get my certification. I went through this 4 years ago. And you can be certified from medical doctors, chiropractors, nurses, occupational therapists, physical therapists, both assistants, speech language pathologists, athletic trainers, and massage therapists. We have the internet resources, Brochure 1. This one was really one of my favorites. It explained what is lymphedema, edema, and why to seek treatment, and then also what to expect. A lot of patients don't have any idea what to expect when their doctor refers them to a lymphatic therapist. Flyer 2 is more of a fun one. This one shows you the grading scales, common risk factors, treatment, and what kind of edema. Brochure 3, lastly, the flyer focuses solely on the symptoms of edema. Some of the most common symptoms that are seen at my outpatient clinic is swelling, pitting, and shiny skin, usually located on your lower extremities. Then we also have the assessments. These links show videos of the actual assessments. The 3 chapters from our MSOT program textbooks that touch on edema are these 3 chapters here. And then we also have the questions from the NEBCOT exam preparation. And then lastly, our resources. My completed, one second. So my completed fieldwork electronic portfolio will benefit myself and my peers while on level 2 fieldwork by preparing for the NEBCOT exam, by educating on specific topic of edema. It will help with properly addressing the condition with the family education fieldwork, and I found it best to organize all my peer topics in electrical file saved to my computer, and I plan on